Hey everyone, this is Sonia from Such a Mom, and this video is part 2 of my second trimester pregnancy symptoms. If you are new here, I am pregnant with my third baby, fourth pregnancy, third baby. It's been a rough pregnancy. I have some high risk issues going on. I have high blood pressure, otherwise known as pregnancy-induced hypertension. I am being monitored closely for preeclampsia. And if you're new here, go ahead and subscribe. I hope you stick around. And we are going to be talking about weeks 23 through 27. I do have a journal over here. I'm going to be glancing at it. For 23 weeks, I had a prenatal visit, and they listened to the baby on the Doppler, and baby sounded fantastic. They did try to measure my uterus height. I don't know what the term is. I'll just stick it in right here. And at 23 weeks, she had me down as 26 weeks, but then she said that it was hard to feel my uterus, especially at 23 weeks. She says it's hard, so she doesn't think it's accurate. We talked a little bit about my irritable uterus, and she gave me more specific parameters to go by. So if I am having regular contractions that last more than 2 hours, then I should go in to be seen. My street is always very, very busy. There's trucks, there's construction, there's stuff going on all the time. And right now there is a truck doing who knows what, driving by. It always sets off my dog. I don't know why he's not barking right now, but thank goodness he's not. But I apologize for all of the noises that you will hear in the background. I did notice during week 23 that I started to feel a little more tired than I had been in my second trimester, hoping that it's not a here to stay thing. I'm not ready for third trimester symptoms yet, and it's just maybe I'm a little off this week. We will be having a growth scan in 1 to 2 weeks to make sure that baby is growing well. And my belly is already bigger than when I gave birth to my 1-year-old. And I'm going to look at that as a good sign, because my 1-year-old was small for gestation. They had just started to monitor for intrauterine growth restriction when I was induced for preeclampsia. So he never got that official diagnosis, but he was small for gestation. I also made a note that baby loves to kick or punch. I can't tell which one it is, my bladder. 24 weeks, baby is officially viable. Such a huge moment to celebrate. Baby is very, very, very active, and I am still, again, tired this week. I hope this isn't a bad sign and that the third trimester exhaustion is already hitting me, because I am not ready for third trimester yet. I still haven't gained any weight yet, but my appetite is definitely increasing. Zofran is working well for the nausea, and it is allowing me to eat more. Sleeping isn't very uncomfortable for me yet, though I think a lot of people by now are having some discomfort with sleeping. For me, not so much yet. The TMI stuff for this week is that I have a ton of discharge. I have to wear a liner and plenty of urine leakage. So wonderful. The other thing I noticed is that I have the pregnancy mask. And I'm going to put right down here the name of what that is. It's also related to the line that you get on your belly, which I have a little bit of at this point. I cover it up with makeup pretty well. I did notice that in some of my videos, my nose looks brown. But I'm going to try to insert a clip right here before I put makeup on and point out the mask. But it's all brown through here. So let's just quickly switch over to that. Before I finish putting my makeup on, I wanted to show you the pregnancy mask, but it's not showing up very well today. And the lighting in here isn't very good. I thought it would be better out here, but so my nose here is like all like brownish, and it falls into, I don't know, is this like part of the T-zone? I don't know much about that stuff. Can you see it? I'll have to look back at this video later and see if it can be seen. It was at 24 weeks, 5 days, 24 plus 5, where I started to feel not right. I started feeling short of breath, lightheaded, dizzy, headachy, and weak. I was still like this at 25 weeks plus 1. So I decided to check my blood pressure. My blood pressure was high. I called my doctor and they suggested that I go to labor and delivery. When I arrived at labor and delivery, they checked my blood pressure and it was 155/94, which is high, and it stayed high for several hours while I was there. While I was there, I also started having regular contractions, and a week or two ago, maybe it was a little bit more than that, I did post a vlog where you're seeing the week in which that I was admitted to the hospital for this very situation, and you will see that I was having regular strong contractions. So they did a bunch of blood work to make sure that I wasn't preeclamptic, and I was not. They tested my urine, they tested my blood, and then they did the Fern swab, which can rule out but not rule in premature labor. So my Fern swab came back positive. If it had come back negative, they could say with very comfortable certainty that I was not going to go into premature labor within the next 1 to 2 weeks. But since it came back positive, false positives are far more common, and they kept checking my cervix during this time. I was contracting for 9 hours total every 3 minutes, and I had no cervical change. So they felt very comfortable that I was not in preterm labor. The contractions did lessen in intensity and in frequency after 9 hours, so that was a good sign as well. They admitted me to the hospital for 24 hours to watch my blood pressures and monitor my urine output to just make sure that I was not going into preeclampsia. I was released after 24 hours, and it was determined that I was not in preeclampsia at this point, and I was just told to be monitored closely and to take my own blood pressures at home. At 26 weeks, baby is still continuing to be very, very active and getting very strong. It feels like baby is trying to dig their way out of my uterus and cervix. I swear that I'm going to have a foot or leg sticking out of my vagina. My hips started to hurt during week 25. Not horribly, just noticeably, and my appetite is increasing even more. Despite my appetite increasing, actually, during week 25, I lost 2 pounds. I'm still having symptoms of high blood pressure where I'm feeling brain fog, dizzy, lightheaded, headachy. I have this feeling of something bad is happening. Like, I don't know if you know what that feels like in your body. It's kind of like an anxiety attack, but that's kind of what it feels like. I also started getting really mild swelling in my ankles, which is very, very normal. At 26 plus 1 and 26 plus 2 weeks, my blood pressure was high for almost 24 hours, quite high. So I decided to call my doctor, and they had me come in. They did labs and urine again, and both came out just fine, thankfully. Still no preeclampsia. However, they did tell me that they would not allow my pregnancy to go past 37 weeks. During this appointment, I was warned that I would probably be having a baby well before 37 weeks. And they warned me about NICU life and other complications that could arise. It's not a determinate thing. Maybe baby will make it to 37 weeks and hopefully they will. But they wanted to warn me about this possibility. So like I said, they won't let me go past 37 weeks. And while my original due date is February 3rd, 37 weeks is January 13th. So we will be having a January baby as long as baby and I stay healthy. I do have it noted here that on 26 plus 3 and 26 plus 4, my blood pressures were fantastic. I wrote down that I only had a couple numbers during those 2 days that were into the hypertension range, but for the most part, really good numbers. 27 weeks is a little bit of a rocky road. In the beginning of the week, I felt okay. I did start having some pelvic discomfort. It's that feeling like your pelvis is starting to separate a little, which does happen in pregnancy to allow for the baby to pass through the birth canal. I feel it more so when I'm sitting straight or on a hard surface like I am now, and I go to stand up. There's some discomfort for a few minutes, but it does go away. Sleeping is starting to get uncomfortable. I'm on the very cusp of the 3rd trimester, and this is very typical. The belly is uncomfortable. My hips hurt when I sleep. I'm rolling back and forth trying to find comfortable positions. I do have a body pillow that I use, which does help a lot. I'm hot, I'm cold, I ache. All the typical lovely physical discomforts of 3rd trimester pregnancy symptoms. On Friday, which would be 27 weeks plus 2? Yeah, plus 2, I started feeling very unwell again. I started feeling very dizzy, lightheaded, brain fog, weak, and faint. And my heart felt like it was racing. Whenever I took my blood pressure during these episodes, my blood pressure would be really high. These episodes don't last, so they're not short episodes. They don't last a couple of minutes and then they go away. I have to go lay down and wait for hours for it to stop. So I pretty much stayed in bed or in a chair Friday, Saturday, and Sunday. By Sunday night, I felt a little bit better. I could get up and around and do some things without feeling like I was gonna hit the floor and pass out. Monday morning, I felt even better, and my oldest son, had a routine EEG scheduled, and I felt well enough to take him in the morning. However, walking from my car into the EEG was enough strain on me that I started to have all of the symptoms again. I sat there while they attached the electrodes to his head, and I was getting more and more dizzy, and I was starting to feel like I was going to pass out. I requested that I was able to sit in the technician's chair for a little bit, and she said that was fine. During the EEG, I was not allowed to be in the room, which is a first for me. That's never happened. So I had to go out in the waiting room, and I had my 1-year-old with me. And I'm in the waiting room and I'm sitting and I'm trying not to lose consciousness while also keeping my 1-year-old entertained and safe. This appointment took 2 hours, and I was in this episode the entire time, and I knew that I would not be safe to drive. I'm not going to get into the very detailed parts of this, but I will say that I did request to see my doctor, whom was actually right down the street from where I was. They refused. I'm not going to get into that. It was an absolutely ridiculous reason. They actually recommended that I go to the ER because I was already in a hospital. I'm not going to the ER where there is possible people who have, COVID, and exposing myself and my baby. I also had both of my children with me, so that was not going to work. So I ended up having to call my mother-in-law to come down and drive me because it was not safe for me to drive. I got home. I was in the car for 40 minutes in a sitting position. I walked from the house to my bedroom. I took my blood pressure and it was 177/100. I sat for a few minutes. I retook it and it was 167/108. So I decided I should probably go into labor and delivery. I went into labor and delivery, and my blood pressure was much better than it was at home. It was just barely into hypertensive range. They did blood work, they did urine work, they monitored me for a long time, and they monitored the baby. My heart rate was high, but my blood pressure was not in any kind of severe emergent state. I'm not going to go into all of the details. I'm going to save that for a different video. But they ended up admitting me and monitoring me for 3 days. They talked about me possibly seeing cardiology. That did not happen. By the end of the 3 days, I felt a lot better and a lot more stable, and they allowed me to go home. And that, I was released on the day that I turned 28 weeks, which is 3rd trimester, and that's going to be coming at a later video. So thank you so much for watching, and I will catch you guys next time.